At this moment in time, Northern Ireland is a great place to work as a pharmacist. A lot of opportunity for pharmacists to join a health service at a time of transformation.
We're the new black in many ways, and demand for pharmacists here has exploded. We've got a clear direction of travel in Northern Ireland. We have a clear transformation agenda for how we see the health service developing over the next 10 years. Pharmacy and pharmacists are critical to delivering that.
I think that pharmacy in Northern Ireland is in a really good place. I think that we are working together to try and think about how we build a really dynamic set of individuals who will be able to work in any environment across the country, and then be available for the patients to work in every sector of pharmacy, and crucially to move between those sectors, so that we're thinking about pulling that knowledge of the whole system through, so that the patient feels that their journey is respected throughout every aspect of healthcare.
Pharmacists joining the workforce in Northern Ireland will be highly valued, and also will be joining a workforce where their skills are recognised, but they're very, very much needed.
There's an exceptional buzz. We are very much starting to be seen as the leaders in a lot of arenas.
It's a great time to be a pharmacist in many ways, because of the development of the role and the areas of opportunity to practice throughout the profession. So pharmacists are very much the go-to. You really are on the cusp of probably a wider range of opportunities than any generation that has come through recently.
Our model of care is recognised as being of the highest standard, so you can achieve that here but also help to take it to the next level. You always need to continue to innovate, and by doing so we have an innovation centre which fosters innovation, service development, research and development, and that then becomes spread and scaled throughout the whole region. So there are very significant opportunities in all branches of the profession in the province, because they all have something to offer to further improve patient care.
I think there's a real movement towards innovation and change in the north of Ireland. We've developed a really strong reputation now for improvements in care and in pharmaceutical care.
Universities are worldwide exemplar for training, and also to come back to Northern Ireland. Well, this is now the time to be. This is actually the most exciting time, I think, to be a pharmacist.
In Northern Ireland and across the UK, we're about to embark on a major reform of the early education of pharmacists. When the reforms to education are implemented, we're going to see that our students who are studying pharmacy for 4 years at university, and then they will go through a 1-year foundation programme that will enable them to come out into the workforce after 5 years as clinical experts in medicines, and also be able to act as independent prescribers. The COVID pandemic presented major challenges for the whole health and social care sector in Northern Ireland, and pharmacy was no different. And for our pharmacy workforce here, that meant that our whole pharmacy teams had to change and adapt their practices very quickly. They had to respond to the need for increased infection control with changes into their physical practice in terms of social distancing and wearing PPE. I think we can see how the COVID pandemic really brought home to people how important their supplies of medicines were. It became very clear that the community pharmacy had a critical role to play in maintaining access to medicines. We've learned many lessons from our experience in recent months in terms of what the role of the pharmacist and pharmacy teams should be moving forward. And as a result of that, I don't think we will ever step back to the way that we were working before.